As we've been hearing this morning, the Prime Minister is meeting with ministers in Downing Street this morning to outline his plans for how health and social care will be funded in the future. Let's speak to the Vaccines Minister, Nadhim Zahawi, about that, other things too. Very good morning to you. And thank you very much for joining us. Let's first of all talk about that announcement yesterday, an extra £5.4 billion to support the NHS's COVID response in England. And that includes the backlog of operations, routine treatments. That has been welcomed, that money, but people we've spoken to this morning here on Breakfast, including the Royal College of Surgeons, the NHS Confederation, say it needs to be much more than that.
So the 5.4 billion that you quite rightly outlined, by the way, within that, there's about 478 million that is ring-fenced for enhanced hospital discharge, which is so important to allowing the NHS to continue to cope under the pressures of both COVID and deal with the backlog of elective recovery. There's 1.5 billion of that. But that 5.4 billion is for this 6 months. There was 6.6 billion for the previous 6 months. And that takes the total for this year alone to about 34 billion of additional funding for the NHS to cope with the COVID pressures. And of course, begin to really deal with that backlog. 5 million we know is the backlog. There's probably an additional 7 million people who haven't come forward for their treatments, for their surgery. I would urge them to come forward because the money is in place to be able to deal with that, as well as, of course, then deliver what will be an incredibly ambitious booster program to deliver the additional vaccine protection to the most vulnerable as we get into the winter.
What people who work in the NHS, patients as well, will want to know is, will that level of investment that you've just outlined continue beyond this year?
So the Secretary of State for Health and the Chancellor and the Prime Minister will be setting out later today how we intend to deal with the real challenges of a social care system that many people will agree needs dealing with and many people describe it as a broken social care system. You can't deal with that without having the additional funding into your healthcare system in place. And you'll hear more details from the Secretary of State for Health on this later today. But you're absolutely right. The two things have to go hand in hand. Greater integration between health and social care, but the funding for healthcare to deal with the short-term massive challenge of COVID and to deal with the backlog has to go hand in hand with what I think will be a truly historic and ambitious reform of social care in our country that the Prime Minister will announce later today.
Right, I'll come to social reform in a second. Just let's go back to the waiting list, because you talk about 5 million being on it right now, and possibly another 7 million who've missed out on treatments. There'll be people watching this morning who perhaps can't go to work because they're waiting for an operation that they need and not being able to get. So when will that backlog be cleared?
No, you're absolutely right. And we've increased, so we announced £1 billion in the previous 6 months to help with the backlog. That's now doubled to another billion in this 6 months. And you're right. So people were waiting about 26 weeks for a surgery. They now are waiting 44 weeks. So that is something that we are serious about dealing with. I mentioned the numbers earlier that there's a 5 billion backlog, but there's possibly up to 7 million people who are waiting. So,
and what I asked you is when do you hope that will be cleared?
So look, I can't give you a date because it would be arrogant and I think wrong to say, oh yes, of course, this money will just clear the whole lot. We're going to make a big dent to deal with the backlog. But I think as things get better, the backlog numbers could grow because, as I said, there are 7 million people who haven't come forward, and I would urge them to come forward for their treatments. Very important that they do. We're making the funding available as we've announced yesterday, and I think we will continue to put that pressure to reduce the backlog as quickly as possible. But I'm afraid I think it'd be completely wrong of me to sit here and say, oh yeah, it'll all be done in no time at all. This is a big challenge. The NHS has dealt with COVID. They've treated 500,000 people for COVID, serious COVID in hospitals. One day in January of this year, there were 34,000 people in hospital with COVID that the NHS had to deal with, as well as, of course, deal with all the other things, continue with cancer treatments, and all the other things that the NHS does so brilliantly. The funding that we've put in for the next 6 months, the 5.4 billion, will help enhance that. And I hope get us to a place where we do finally deal with the backlog. But it's not an easy thing to do.
And the Health Secretary has said, and I think it echoes what you're saying, it could get worse before it gets better with regard to waiting lists. I mean, how much worse?
Well, so we know that there's 5 million people that we have to deal with the backlog, but we also think there's up to 7 million people who have come forward.
Yeah, you mentioned the 7 million. Thank you.
So you could be seeing that number in the backlog increase whilst actually things are getting better, i.e. people are beginning to see the difference. There are 300,000 people who are waiting for non-urgent treatments, knee, hip replacement, cataract. Now, they may be non-urgent, but they are detrimental to people's lives, which is why we've announced this funding that is so important for the NHS to deal with that. And you need that to get the NHS to be fit for purpose, so that social care reform is given sort of as much space to be successful, but by having a really strong NHS to integrate with.
OK, let's talk about the reforms to social care. And I do appreciate that you're going to tell me that the Prime Minister will set out the details later. But let's just talk about the principle if we can. And we understand that it's likely to be a 1.25% rise in national insurance. In principle, would you back that? Well, look,
I don't want to speculate, and it would be, I think, unwise to deal with hypotheticals or in principle, as you put it.
But you're a politician. You must have your point of view on whether that is the right thing to do.
Well, politicians who've left office and are not in the government team can speculate on these things as people are doing in the media. But I think it would be wrong for a member of the team, before my Prime Minister has stood up at the dispatch box and set out the plans and held that press conference afterwards with his Chancellor and his Health Secretary, for me to speculate on the detail of how we're going to fund this.
I'm not asking for details, because I know that you're not going to give me the details. Let's just put it to you, the question, in a different way. For example, there is a lot of concern, and it's across parties, actually, isn't it? It's across the Conservative Party. We also heard from Keir Starmer overnight. There's a lot of concern, if it were to be national insurance, that it really puts unfair pressure on low earners and young people.
Well, look, I hope you understand that I am not going to comment on hypotheticals. Let's wait for the details. It is not in the Minister for Vaccine Deployment's remit to deal with the finances of the government. That is very much firmly in the Chancellor's portfolio. And I think it'd be wrong of me to speculate on these things until you've heard from the Prime Minister, from the Chancellor, and from the Secretary of State for Health. So forgive me if I don't get into it. What I can say to you is that the social care system has been unfair. If you have assets of £23,350, you really begin to hurt if you, for example, suffer from dementia. 1 in 7 people pay over £100,000 or more for their social care. So it has to, in my view, has to be grasped. That nettle has to be grasped. And this Prime Minister will not shirk that responsibility. And you'll hear from him later today as to how we're going to deal with the broken social care system over the long term.
What do you say to your Conservative colleagues that you might be about to break a manifesto promise?
Well, I think, as I said, I will want to wait till the Prime Minister's on his feet, who will set out the details, and then his Chancellor will set out the details of how we're going to pay for this. And then we can have that debate. And I'm sure I'll come back on your programme and we'll have the national debate, as well as obviously the debate in Parliament and a vote in Parliament. The important thing to remember is this Prime Minister promised a plan to once and for all deal with a broken social care system and have a real plan, a robust plan that can do that. Very different to where Keir Starmer and Labour Party are, I have to add, in terms of sort of sniping from the sidelines, but not really having a plan. When the Prime Minister sets that out, we'll have that debate and we'll have those discussions and votes in Parliament. And I hope reach a place where we can all feel proud that we have actually really delivered on the promise of fixing our social care system.
Many people will remember the Prime Minister saying that would be fixed when he walked into 10 Downing Street.
Well, I would respectfully dispute that. What he said is he has a plan, and he will absolutely engage with people who have lived experience of the social care system, both national and local leaders in the social care sector. And I think you will see later today and in the press conference tonight that we will deliver on that plan, deliver on that promise. But look, let's be realistic here. The social care system has been broken for many, many years, many decades. Many successive governments have talked about this, have consulted, but never really delivered. This Prime Minister is determined to deliver. It will take time. I'm not arrogant. This government is not arrogant to say, we have a magic wand and we can fix it in 5 minutes. But we are determined to at least make sure we implement that plan and the funding for social care.
And then the Prime Minister said that he would fix with the crisis with the plan that he had prepared. We're talking years on.
Well, and this is not easy. And I've said to you, successive governments, Tony Blair stood up and said he had a plan, he wants to fix it. Nothing happened. Labour today don't have a plan. What they have is people who are just sort of sniping from the sidelines. I hope they'll look at this plan very seriously. And I hope that together we can, as we have developed and deployed vaccines in such a successful way, we can together finally deal with the social care system. That our constituents, people who are suffering a broken system, deserve better. And I think this Prime Minister will deliver on that.
Are you looking at a possible lockdown in October?
So I'm absolutely focused on making sure we don't have to reverse all the great gains we've made in terms of opening up the economy on the booster campaign. So the big thing for us, we've had the interim advice from the JCVI where they very clearly said that we have to both boost the most vulnerable against COVID infection and flu. I worry about flu. We've got a big flu program that has begun and will continue throughout the winter months, as well as I hope our COVID booster program, which will begin shortly this month, once we've had the final advice from the JCVI.
Can I just ask you, I'm sorry, I just need to ask that again, if I could, to just try and get a clear answer. Are you looking at a possible lockdown in October?
No, I haven't seen any. I know where this question comes from. I think there's the newspaper was reporting that they think there's a possible lockdown. Look, vaccines have given us the ability to reduce infections, to save 100,000 lives. It is through the booster program that I hope, and I'm not going to be arrogant, say to you, this is a sort of done deal. It's all over. It's fine. That this virus is no longer in pandemic status. But I hope through the booster program we can transition the virus from pandemic to endemic status and deal with it. Year in, year out. It's going to be with us for many, many years, but not have to close down our economy or take, the severe measures we had to sadly take at the December of last year. So it is through continuing to get your vaccination. There's an evergreen offer for people, and people are still coming forward, by the way. In the last week, we still had something like 111,000 people who had their first dose through that evergreen offer. And of course, the booster program will enhance that protection and durability of the protection of the vaccines to the most vulnerable.
Thank you. Vaccines Minister Nadhim Zahawi, thank you for talking to us here on Breakfast.